Hey there, everyone. Happy Tuesday. Thank you so much for tuning in tonight. I'm Meg Wheeler, and I'm a candidate for Massachusetts State Senate in the Plymouth and Norfolk District. I'm just going to get us live here on Instagram as well. Bear with me for 1 minute. Hi, everyone. I'm Meg Wheeler, candidate for State Senate in the Massachusetts Plymouth and Norfolk District. Thank you so much for joining me this evening. So I will be going live every night for the near future at 7:30 p.m. Eastern in order to give you an update on what's going on with COVID-19, what's happening in our district, and really just to be a resource. If you have questions, please tune in and join us. If you're just looking for an update, this is a great place to get it as well. So tonight, we're just going to do a general update. Moving forward, I will have specific topics for each night. So tune in for that if you are a small business owner, if you have kids, you're stuck at home, and you're curious about what to do and how to survive this. We're going to have nights where we specifically focus on that as well. But tonight, we're going to just do a general update. If you have any questions, feel free to drop them in the comments. So before I kick off the update, though, I do want to give a huge thank you to all of our medical professionals, our doctors, our nurses, our hospital staff, our first responders, everyone who is out there every single day battling COVID-19 and ensuring that the rest of us are staying safe and healthy, and that, hopefully this pandemic is not as treacherous as it could be, frankly, if we didn't have you. So thank you so much for the work you're doing, for the time you're away from your families, for the risk you're putting, the risk you're taking. I'm just so incredibly grateful. I also want to thank all of the town leaders, our local government, especially the schools, who, this is an unprecedented time. And, to cancel school for a month, possibly longer, and shift that education, that learning offline is incredibly difficult. As the daughter of a school teacher, I know this firsthand. We were actually laughing. She just recently retired. So she is not having to deal with this right now, but I told her she picked a great time to retire. But it's just having to make these huge shifts, and it's not just in our public schools, it's in our universities as well. To all of our professors out there, just thank you for all of the work you're doing. I know that this is incredibly difficult. So let's get into a bit of an update here. So as of today, there are 1,159 cases of that have positively tested in Massachusetts, and that's up 382 from yesterday. Not surprisingly, because we can now test more, we will have more positive cases every day. So I don't say these numbers to alarm anyone. I think we all expect the numbers will go up. But just note that is what's happening. So 13,749 people have been tested in Massachusetts so far. 8,922 as of yesterday. So that's a huge jump. Now, Governor Baker had said that his goal was to get to about 3,500 being tested minimum every day. And it seems like we're just starting to hit that. So that's good news to hear that the tests we need, we're getting. Unfortunately, total deaths in the state right now sits at 9. 600 people have died in the United States from this, 17,000 globally. So this is not something to take lightly. This is something we need to absolutely take seriously. And it's something we need to be very cognizant of so that we can keep that death count as low as possible. If you would like to get updates from Massachusetts, the state itself has put together kind of a COVID-19 hotline, if you will. You can test COVID-MA, so COVID-MA, to 888-777, and you will get the updates from the state as they issue them. Now, really briefly, I know there's been a lot of information on this, but just really briefly, let's actually talk about what some of the symptoms of COVID-19 are. Because I know I've had a lot of people say to me, well, I'm not sure if I've got it or not. I'm not feeling well. So the biggest symptoms to look for are fever, cough, shortness of breath. Those are the big differences that you're going to see versus just the common cold. I'll tell you, I don't know if you can tell by my voice, I've been struggling being sick for the last week, but I knew this wasn't it because I didn't have any of those symptoms. So those are the symptoms to look for: fever, cough, shortness of breath. Emergency warning signs would be trouble breathing, if you're having persistent pain or pressure in the chest, and if you have bluish lips or face. If you think you've been exposed to COVID-19, excuse me, and you have the fever and the symptoms, call your healthcare provider, call your local board of health, or you can call the Massachusetts State hotline at 617-983-6800. If you develop those emergency warning signs I mentioned, trouble breathing, persistent pain or pressure in the chest, bluish lips or face, please do seek medical attention immediately. Now, how can we prevent this? I think the biggest thing, we keep hearing this, is to stay at home. I've been home now for over a week and a half. To me, this is the least I can do to make sure that I don't spread this. And I think the attitude to have isn't, I'm not going out so I don't get it. The attitude to have is assume you have it and assume that if you go out, you will spread it. So the more you can stay at home, if possible, the better. We're going to talk about the stay-at-home order in a second, but that's the biggest thing. Washing your hands with soap and water for at least 20 seconds. Of course, that's always a good thing to do, but especially important now. Avoid touching your face if you can. I know this is tough. Clean and disinfect your surfaces often. And if you have any questions, you can actually dial 211. This is their information hotline. You can get more information on the virus. Let's talk about the stay-at-home order. So Governor Baker put out a stay-at-home advisory from today through April 7th at noon. It was based on federal guidance, but it was adjusted for our state's needs. So I'm going to go through a list of some of the things that it covered. There is a really comprehensive list online. We've got it right here, but it's pages long of every single thing that counts as essential versus doesn't count as essential. So I would recommend, if you have a specific question, feel free to go to the state's website, or you can message us. I've got it right here and I can look it up for you. Okay, so this stay-at-home order closes down all non-essential businesses, and essential businesses include, so in the health sector, these are people who are essential, meaning this does not apply to them. Medical professionals and caregivers, hospital personnel, for example. The chiropractors and massage therapists are not considered essential, so those businesses would have to shut down for now. Law enforcement, public safety, and first responders are considered essential. In the food sector, workers supporting grocery stores, pharmacies, and other retail that sell food and beverages, including liquor stores, are considered essential. And essential services include breweries and third-party delivery workers such as DoorDash or Grubhub. In the utility sector, this is electrical, gas, propane, wastewater workers. In the transportation sector, this is mass transit employees, rideshare operators, and rental car companies. Bike shops are considered non-essential, so those would have to close. Now, businesses that are allowed to remain open should practice safe social distancing principles that are issued by the Department of Health. There is a form, if you are a business that has technically been classified as non-essential per this list, but you think you should be considered essential, then there's a form on the mass.gov website that you can apply to be considered essential. So if you are concerned about that, please check that out. Let's talk about transportation really fast. And 1 second, I want to pull this up just so I can see all the comments. Perfect. Okay. So transportation, the sort of directive is to reduce travel as much as possible. Really, the mass transportation system currently exists to get essential folks to the hospitals, to the grocery stores, to their job, first responders to their jobs. Stations and vehicles are being cleaned more frequently to prevent the spread. The bus and Silver Line, most of the routes are on Saturday service schedules. The subway, there's Saturday service on the red, orange, and green lines. There is Saturday service with increased frequency on the blue line and the green line E branch, and that's to get those essential workers to their jobs. The commuter rail has reduced service across the board. The ferry has completely shut down, and the ride has no planned service changes at this point. And again, if you have any questions, please feel free to put it in the comments, and I'm happy to answer questions as we go along. So the next thing I want to talk about is the support for residents coming from the state level. So let's talk about insurance coverage first, health insurance. I think this is a big question that I know I've gotten a lot of people have reached out to us about. So mass health insurers are required to cover the cost of testing and treatment for COVID-19. This also includes not having copays or not having deductibles. So if you have any issues at all, or I should say if you have any concerns at all, know that you will not have to pay for the testing or the treatment of COVID-19. Mass Health Connector has opened up special enrollment for insurance through April 25th. So if you do not currently have health insurance, please check out Mass Health Connector. They've opened up enrollment for that. Mass Health is expanding telehealth coverage. They're allowing 90-day and early refilling of prescriptions. So if you need to get a prescription refilled, I recommend getting more of it so you can limit the amount of time you're having to go out. I will tell you, across the board, health insurance companies have been ordered to provide telehealth. I personally had a telehealth appointment with my therapist last week. It was great. So if you've been hesitant, please don't. Check it out. It went pretty seamlessly. So it's one good thing to come out of this. Now, the Attorney General does have a healthcare helpline. If you have any questions at all about health insurance, the number is 888-830-6277. Let's move on to unemployment. So later last week, the legislature waived the 1 week period for unemployment. So you no longer have to wait a week to get benefits. They've also expanded eligibility. So if a worker has been quarantined due to an order by either a civil authority or a medical professional, they will be covered for unemployment. If they have to leave employment due to reasonable risk of exposure or to care for a family member, they will be eligible, and they do not need to provide medical documentation for this. If they become unemployed because of layoffs or shutdowns or even temporary shutdowns, they will qualify for unemployment. This applies to all full-time and part-time workers. Again, even if your workplace is only temporarily shut down. So unemployment has been expanded. So I hate everybody just joining now. Now, self-employment individuals and 1099 contract workers, unfortunately, are not entitled to unemployment. This is something that I know as someone who runs my own business. Unfortunately, we are not subject to those benefits. Hopefully more is coming on that. Hopefully more financial assistance is coming on that. We'll talk about that in a second. If you contract the virus, you may be eligible for workers' comp as well, in addition to unemployment. So keep that in mind. And if you have any questions about unemployment, earned sick time, paid leave, or just any of your workers' rights, call the Attorney General's hotline at 617-727-3465. Let's move on to small business assistance, because this is another one that a lot of people have reached out to me about. As a small business owner, this is something that I'm very concerned about. It's something that I'm very well aware of how hard this is hitting our industry and our livelihood. So sales, meals, and room occupancy taxes for March, April, and May are now delayed until June 20th. So if you normally have paid those, you have a little bit more time to pay them. This is as long as you have paid less than $150,000 in your regular sales tax plus meals or room occupancy taxes in the year ending February 29th, 2020. So basically a year back from this February, that whole last year, as long as you paid less than $150K, you get this extension to June 20th. Employers whose businesses have been severely impacted can also request extensions to file and pay their unemployment contributions. You do have to actively take that step, but you can get an extension. And the Small Business Administration, SBA, does offer their economic injury disaster loans of up to $2 million. This is a low interest loan, can be spread out over a very long period to repay. It applies to both small businesses and nonprofits. The eligibility is based on the financial impact as a result of COVID-19, so you have to actually have shown some financial hit. The deadline to file for this is actually December 18th, 2020. So you've got some time to file, but I would recommend filing as soon as you can because a lot of people are going to be filing for this assistance. Now, moving on to utilities assistance. So DPU has issued a moratorium on electric and gas shutoffs by all private and public utility companies until the state of emergency is over. So if you're concerned about that, if you're concerned about your utilities being shut off, please do not be at this point. That will not happen while we are in a state of emergency. National Grid has paused their collection activities and disconnections as well. So this is across the board. Governor Baker said he is filing a bill with the legislature that is going to allow cities and towns to loosen a variety of state mandated regulations and deadlines around budgeting and tax collection. So the biggest question I keep getting, we're going to talk about the IRS in a second, but the biggest question I keep getting is there an extension to file and pay state income taxes? And as of right now, there is not, but this is one of those things that Governor Baker has said that they're discussing and hopefully they will address. This bill that he wants to file will also include regulations around education policy, construction permitting, and even the rules preventing restaurants from selling alcohol to go possibly. So they're talking about kind of a lot of different things that they can possibly change to help ease the stress during this time. Now let's talk about support on the federal level. So speaking of taxes, the IRS did announce that they are pushing the deadline for tax filings and payments for non-corporations, as long as you owe less than $1 million, pushing them from April 15th to July 15th. So you now do not have to file or pay your income taxes until July 15th. However, if you are expecting a refund, I would highly recommend you get your tax returns in now, ASAP, as soon as you can. I know that they're going to be overflowing with requests for refunds as people need cash, so get them in quickly. Let's talk about what's actually happening in Congress. So there have been 2 bills that have been passed so far related to COVID-19. The first package was an $8 billion financial aid package on March 6, 2020. So $3 billion of this was to develop treatments, including $300 million for the government to purchase drugs from manufacturers at what were called fair and reasonable prices. $2.2 billion for public health measures to help prevent the spread, and $1 billion to be spent overseas combating the virus. So that first bill, or that first package in early March, was really to help prevent and treat the virus. The second package, which came through last week, provides sick and family leave for some U.S. workers. So 100% of their normal salary for 2 weeks to anyone in quarantine, anyone helping a family member with COVID-19, or anyone whose children who have children whose schools have closed, and then 67% of their normal salary for 12 weeks to many of those that have children whose schools have closed. So that was the big package last week. It also expanded unemployment assistance. It increased food assistance to ensure that kids who could not go to school would still receive meals. It increased funding for Medicaid, including funding for testing and treatment. This is one of those. This is the one that guaranteed that you will not have to pay for testing or treatment, even if you don't have health insurance. Now, as of yesterday, the CBO, the Congressional Budget Office, hadn't put a price tag on this bill yet. I don't know if that's come through. But the last bill, which is the one that is currently being debated right now, is on a $2 trillion stimulus package. So it's currently being debated in the Senate. This is the bill that the Republicans got together, crafted a bill, and are now negotiating it with the Democrats. The Democrats, unfortunately, were cut out of the process of creating this bill, so they're now having to come in and ask for the things that are important. So this $2 trillion package includes direct payments to Americans as well as other stimulus measures. It includes $500 billion for distressed companies. One of the things that the Democrats really wanted and that they kept pushing back on because it had not been included was oversight over how these funds were spent. And okay, and so I've got a question. So Connor says, are you in favor of the government giving cash directly to Americans, and what do you think is reasonable, $1,200, $2,000, etc.? Connor, it's a great question. Here's the thing. I think Americans are really hurting right now, and I think the cash assistance will help get some money into people's pockets so that they can pay bills that are due now, frankly. Even though I've talked about some bills that are being delayed, they're not being waived entirely. People still have obligations they have to take care of. So I think it's a good thing. I don't think it solves the problem. I think widespread, we're going to see small businesses hurt by this. I think we're seeing people laid off, people who are out of work for weeks and possibly months at the rate this is going. $1,000 check, a $2,000 check, while that is going to help a lot of people right now for a little bit, does not get us the full way there. So yes, I'm in favor of these checks, direct checks as they're calling them, but I think it's the first piece of the puzzle. And I think what's more important and what I would like to see in these bills is more funding and more thought given to how we're going to help small businesses get through this. One of my concerns with what I've seen so far is the relief for businesses in this bill is aimed at the bigger businesses like the airline industry. Now, don't get me wrong. I think it's important to make sure that these big industries that have a lot of jobs are stabilized. But I also think we need to remember about all of our small businesses that I'm seeing every single day struggling, making a tough decision whether they stay open or close. And those are the businesses that I think are being left out of this. I mentioned earlier, unemployment is expanding, which is great, and our workers need that. But our small business owners, our 1099 contract workers aren't getting that benefit. And yeah, $1,000, $2,000 check is going to help, but maybe that pays the mortgage. Maybe that pays the mortgage and your groceries, and that's it. What do you do next month? So I think it's a step in the right direction, but we need to do more. In terms of how much is reasonable, that's a great question. And I'll be honest, I don't know. I would, that's the kind of thing that I would want to look at the different numbers, the different scenarios, and see what makes the most sense. But as I said previously, I think it's enough to help people get by for a little bit, but I don't think it solves the long-term problem. And so I would hope that there would be more to come to help people stay afloat. So great question. Thank you for that. So there are still concerns that this bill in the Senate prioritizes businesses. I mentioned this briefly in my answer to Connor, that it prioritizes businesses over individual workers and prioritizes big business over small business owners. And also that it lacks oversight. So one of the things the Democrats fought for today was oversight of this $500 billion fund for distressed companies. And from everything we're hearing, they're getting that oversight. It's been added to the bill, which I think is really important. One of the things that you'll learn about me as you hear me talk more about where I stand on issues is that while I am in favor of using financial resources to solve some of our big problems, I 100% believe that we need to have transparency and accountability in how we spend that money. I don't believe in writing big blank checks and not following up. So I'm glad to see or glad to hear that this should be part of that final bill. Now, Nancy Pelosi, Speaker of the House, today came out and said that the current version of the bill provides more for individual workers, which is great. That's something we had been fighting for, and also boosts resources for state and local governments to the tune of $150 billion. It also includes expanding unemployment insurance as well as sending $130 billion to hospitals to help them fight this. The current bill does not include an increase for food stamps and other nutritional programs. That was one of the things the Democrats had asked for. They had also asked for funding for vote-by-mail programs to handle our upcoming elections and hopefully facilitate that process. Neither of those are included in the current bill. So once the bill is agreed on, the hope is actually to pass it by unanimous consent in the House so that House members do not have to be called back. There are obviously concerns about House members having to come back and vote. But the downside to this, of course, is that if it's by unanimous consent, one person can stop this. So, Nancy Pelosi is working now to see if she can get the caucus on board with this bill. So talks continue. I'm optimistic. Hopefully we will have a decision tomorrow on this. Hopefully it will move forward tomorrow, but we will see. We'll obviously be back here tomorrow night to update you. Let's move to housing, because this is another thing that people have reached out to me about. People are concerned about how to pay their mortgages. So the U.S. Department of Housing and Urban Development announced a foreclosure and eviction moratorium for single-family homeowners for the next 60 days if they have Federal Housing Administration insured mortgages. So 60-day moratorium on foreclosures and evictions. So mortgage providers, so this is Freddie Mac and Fannie Mae, are encouraging homeowners to contact your mortgage service providers immediately if you're in financial straits. Now, Freddie Mac's mortgage relief options include ensuring payment relief by providing forbearance up to 12 months, waiving assessments of penalties and late fees, suspending the reporting of delinquency because of late payment, and then allowing the servicers to actually offer additional repayment programs or mitigation programs for folks. Fannie Mae's are very similar. So homeowners are also homeowners may request mortgage assistance by contacting their mortgage servicer. Again, foreclosures and evictions of borrowers are suspended for 60 days. Again, that forbearance of up to 12 months on payments. If you need it, you do have to request it. I want to make that clear. You have to call your mortgage servicer and request it. This is not an automatic thing, but I highly recommend you do it, and do it now. Even if you don't think that it's going to be that, like if you think you might be okay, still call, find out what the options are now, just so you have that information. Let's move to student loans before we wrap up for the evening. So the federal government has announced that they are waiving interest on student loans that are owned by the U.S. Department of Education. Unfortunately, if you have private loans, that does not include your loans. I am one of those people who refinanced and consolidated my loans, and they are now private. So for those of us, this unfortunately does not apply to us. One of the questions that has been put out there is, will there be assistance for folks across the board? And that's still an open question, whether or not your loans are owned by the U.S. Department of Education. But if they are, interest is waived for at least 60 days. You will have the option for these 2 months to also suspend your payments. So you can still make payments during these 2 months. If you do, 100% of your payment will go towards paying your principal, because they're not imposing interest for 2 months. If you want to waive your payments for 2 months, you need to call them. So the interest thing happens automatically. The waiving the payments does not. You've got to call and ask if you want to suspend payments for 2 months. However, if you are more than 31 days delinquent on your student loans, or if you go more than 31 days delinquent on your student loans during this period, they will automatically waive your payments for you. Again, much like with mortgages, I would 100% recommend that you call your loan servicer, talk to them, fully understand what the options are. Don't just let it slip and hope it'll be okay. Because I think there's a lot going on right now, and stuff can get missed. The Attorney General also does have a student loan assistance unit. So the number for this is 888-830-6277. And they can help you apply for repayment plans, avoid defaults, and in rare cases, apply for discharges. So that can be a resource for you as well. So just to wrap up, again, I'm going to be here every single night for the near future with an update. I will be bringing you, different tips every night, depending on, we'll have different themes, different topics to talk about. But tonight I just wanted to give a really big general update, since this is our first one that we're doing. Again, I just want to remind everyone to please stay home if you can. I know it's tough. I know it's really hard to feel cooped up. You want to get out there. The weather is starting to get nicer. But, after watching everything that's been happening, it is incredibly clear to me that if we do not take this seriously, and if we do not stay at home and limit our interactions with each other, then this is going to be so much worse than we ever imagined. And I truly believe that we can all come together and do this. I've seen it in our communities. I've seen it in our neighbors. I've seen it in our local leaders, that there is incredible support for everybody just banding together right now, respecting these rules, and looking forward to when we can get back out there and spend time with each other. If you have any supplies, if you've got any masks, if you've got the gloves and you can provide them to hospitals or medical providers, please consider doing that. If you don't know who to provide them to, reach out to us. We can connect you. Donate blood if you can. And several doctor friends of mine have said this to me, that if people can donate blood, it's incredibly important right now. There are hospitals that are running out of blood for blood transfusions. You can go to your local blood banks. They are taking incredible measures to make sure that everything is sanitized and scrubbed down, and you can safely donate blood there. So if you can do that, please consider doing that. Also consider donating money to reputable charities like the American Red Cross, or like your local food banks. Our local food banks, especially now, are going to be hit really hard as more and more people are out of work. Lastly, support your local businesses. Buy gift cards, buy products if they've got them. If they're restaurants and they're still open and you can go there safely, please do that, and support the workers as well. I've been hearing that people picking up takeout aren't tipping, and just I know everybody's struggling. I know this is really tough, but if you can, please remember to support both the small businesses and the workers. I personally set up, not the campaign, but I personally set up the South Shore Tip Jar, which you can find at southshoretipjar.com. And the way this works is it's a list of local folks who are, financially affected by what's going on. And there is a GoFundMe. So every dollar we raise once a week gets divided evenly between everyone on the list, or you can donate individually to someone on the list. So consider that as well if you're looking for a way to help. I hope this update has been helpful for you. Again, I'll be back here tomorrow at 7:30 p.m. If you have any questions at all, you can always reach us at hello@megwheeler.com. You can DM us here, or you can give our campaign a call at 781-724-3461. So thank you everyone so much for tuning in. I hope you are staying safe and healthy and somewhat happy, and maybe getting some time to spend with family, hopefully. And if you are out there on the front lines fighting this, whether you are a restaurant worker, a nurse, a doctor, hospital staff, a first responder, whoever you are, if you are out there fighting this for us, thank you. From the bottom of my heart, thank you. We will continue to do everything we can to support you. So thanks everyone. Have a great night.